So what lifestyles increase the risk of spine pain or disorders of the spine? You know, being inactive, sitting around, the more pain you have. On my last surgery, where I've had to wait 12 weeks for the bone to heal, I've been pretty inactive. And I'll tell you, I have more aches and pains in other areas of my spine and my other joints because I'm inactive. And then as I became more active rehabbing, my pain lessens dramatically. So staying active, really getting to the gym if you can, and getting a trainer if you need to, but at least staying active, taking walks daily, getting out, maybe doing some lightweight exercise. I think men tend to need to do a bit more cardio balance exercise, and in general, women should do a little more weight training. All should do more weight training. This new study is showing that doing weight exercises reduces your chance of dying early. And that's a recent study that was just published. So staying active, functional, reduces the chances of having spinal pain and spinal disorders. So take good care of yourself.